It's Chris Spire.
Hello, it's Chris Bowling. How are you?
Good, CV.
What what are we going to talk about?
Well, here we are, mid-year 2024. I wanted to talk more about telehealth and some of the updates that we're seeing from a use standpoint, new developments,
Yeah,
and maybe some education ideas that our HR teams can take to their members and their employees for their families. I think we talked a lot about telemedicine and virtual visits pre-COVID.
yes.
Most every medical carrier has something built in. If you don't have it built in, you've got a standalone that's there. I know we've seen a lot of employers drop the cost share to zero to try to get utilization,
Heck yes.
but we're seeing very, very low utilization with our clients in the last 6 to 8 months. Winter's over, doctors' offices are open, and people are back to their habits of just going to what's open, usually the most expensive place. You would agree we're seeing this, like people are back to using the ER again when they shouldn't be.
Yes. We got so excited through COVID. It's like finally after 10 years about pounding about virtual health, man, it's finally working. Well, that's because there were no other options.
Yes.
So now here we are, like you said, everything's wide open again, and our utilization is just straight down the toilet. And it's the constant education we have to do. It's
Yeah.
just out of sight, out of mind.
Yes.
But yeah, I was just so disappointed. I thought finally they're getting it. Finally they're going to use it.
Yeah.
And
And even making it free, I think still the challenge is when something's going on, do I think about my telemedicine program first, or do I think go down the street where it's open? I won't say every employer is seeing that uptick, but certainly emergency room visits are up. And not just because we're in the summer months. I'm saying year over year, we're seeing that they're creeping back up and expanding because it's convenient and open. So I think some of the education that we're looking at now is it's mid-year. Now is a great time to send out information on your telemedicine program. We've recorded some videos that go out, in the second quarter for employees just to remember that this is available. But we're also seeing that some employers are expanding what they're allowing their virtual visits to cover, not just general medical care. What have you noticed?
mental health,
Yeah.
we have a crisis where there's just not enough psychologists, psychiatrists, and it's amazing that the ones that I know personally, they don't want people back in their office anymore just because they can crank them out if they stay virtual.
Yeah.
And I think as we look at EAP programs and we look at different programs that are specific to mental health, to your point, it's amazing how many of our clients are saying, okay, great, we've added the virtual, but I've got employees that want the ability to see face to face again.
Yes.
And that's another challenge because now we're looking at what vendors have the right networks.
Yeah.
But yeah, man, mental health is it just doesn't seem to be getting better.
No. No, and we have some clients that provide that service that
Yeah.
they provide it for other organizations. They provide it in a medical care setting, and even they are trying to figure out how do they staff appropriately to cover the need that exists. I think adding mental health to your virtual visit may be an option just to give somebody that choice if they don't have a provider that's available taking patients in their community or within a short drive.
Right.
Then we're also seeing dermatology become more important through virtual visits, not just having to go into the specialist, but being able to get that quickly taken care of and looked at. It's a topical thing, especially for the summer.
Big tip for HR. Literally take a picture of what poison ivy looks like. What if you get bit like it, with a tick like me? I mean, that was literally my last virtual visit. Had a tick on me. It was red. What do I do? Yeah, all of that stuff. But yeah, help your employees. I think the biggest thing we also learned is doing a video on how to install it,
Yes.
what information you need,
Yes.
because there's so many apps that look very similar to what you may have. If it's Healthiest You, if it's Health Joy, if it's Doctors on Demand,
Yeah.
Telehealth,
Just
Teledoc.
the steps.
But
And I think
you
it's been a number of years now that we've done it, but we had several employers do just enrollment giveaways. If you enroll in telemedicine, you show us that you've set up your account, we're going to give away something. Gift card, PTO. This might be the time to think about that again, just to bring the awareness back to try to get that not just with the employee, but their household as well.
Totally. Yes. Great point. Good topic. I think once again, you know, for the consultants out there, we're all struggling, you know, if you got good ideas, we'd love to hear, because I think this is, you know, this industry is all about sharing. And,
Yeah,
you know, if we can all get better, then, you know, obviously we can address this challenging industry, which is costs just continue to go up and up and up. So
for sure.
love it. Good topic.
Yes. Thanks, CB.
We'll see
We'll
you.
see you.
All right, bye.